A patient goes to you and they're currently wearing a denture, upper and lower denture. What are their options as far as getting a brand new set of teeth with dental implants?
Well, number one, their first option is a new denture.
Okay.
The second option is what I call a snap-in, snap-out denture. That's minimal amount of implants, but that's still a denture. It's still acrylic, which rests on your tissue. So it limits your ability to bite hard as if you had your own natural teeth.
Okay.
Acrylic is porous, it can stain, it can smell, and it can wear. The next option is a prosthesis or a denture that's on a bar.
Okay.
It's still acrylic, so you still have the wear, you still have the staining.
And it snaps in, snaps out.
It still snaps in, snaps out. You can bite harder, but the denture teeth is out of acrylic and it wears away.
Okay.
Okay. The next option is truly the optimal option. It's where it's porcelain or non-acrylic, where it's a material that doesn't stain. It wears like natural teeth, and the aesthetics of it, because it's porcelain, is very tooth and natural.
So if everything works out right, how many implants on the bottom to give them a full arch of teeth?
You can do it as minimal with 4 implants, but it can be up to 8 implants.
Okay.
And at our clinics, it doesn't matter how many implants, it's just one set.
Now the upper, like on the upper denture, because it has the roof covered like suction, so that's okay.
Well, if you worn a denture, you know that that's terrible. You can't taste your food. You can't recognize the temperature of the food, and that makes a difference. That makes a difference. Yes, there's suction, but when you can't taste the food, wouldn't you want to taste the food?
So that's the same kind of thing, like 6 implants. You give them an upper set of teeth that don't come out.
You don't come out. The palate's not there. The material is porcelain, so it's really smooth to the cheek and tongue. And the great thing is the materials that we're using in our practices, the food doesn't stick. Bacteria, it's easier to maintain and clean for the long term.
And how old can you be to get this done?
There is no age limit. There is no contraindication to age.
Like 80? You can do it?
You can. I've placed an implant and given a new upper and lower set of teeth to a 101-year-old.
Really?
Yes. In fact, I delivered this new set of teeth on his 100th birthday.
Is that right?
It's the best present I've ever given.
And they can eat and chew whatever?
There is no limits. I mean, he's biting apples. He actually told me that he loves seeing bite marks in his food.
Right?
In his food. And I found it strange, but I find that's a common type of response because they weren't able to do that before.
So it doesn't matter how old, 80's young then, 90, if a 101-year-old can do it, an 80-year-old, it's no problem.
It should not be a problem.
And I read an article that, if you're over 80, they're on 4 or 5 medications. You can work with those kind of people and still qualify for this procedure?
Absolutely, absolutely. We always, have a conversation with their physician, their medical team, and making sure that everything's okay. But there are really no limitations on age or medications or anything like that.